Our next big topic. In general, this is a condition where the body lacks enough RBCs, those red blood cells, to carry oxygen around the body to perfuse the tissues, typically resulting from blood loss, like surgeries or excessive menstruation, or even from taking immunosuppressants, which suppresses the bone marrow where RBCs are made, but more commonly from the lack of iron, B12, and other building blocks to build RBCs. Clients who are anemic will present with tiredness and fatigue, with shortness of breath, dizziness, and even pale skin, called pallor. All these signs and symptoms are due to the low RBCs, which are supposed to carry oxygen on their hemoglobin attachments to help perfuse the body. So a big NCLEX tip here. Hemoglobin is the lab to know, so write it down. Normal values are over 12. Now it becomes bad when it's 8 to 9. And anything less than 7 sends your patient to heaven. These are must-know key numbers here, so write it out and know it by heart. Now, the main types of anemia to know for exams are iron deficiency anemia, sickle cell anemia, and pernicious anemia. But really the most tested on the NCLEX are the top two here. So let's cover these first. Iron deficiency anemia is where the body lacks iron, which is a critical building block to help make RBCs, our red blood cells. Now, it's the most common type of anemia globally. So Kaplan mentions, the nurse understands which is the most common type of anemia, iron deficiency anemia. Now, it's caused by a diet low in iron-rich foods. So the key terms to know for exams is any diet low in meat, fish, and poultry. These contain rich sources of iron according to the NCLEX. Now, fruits and green leafy vegetables do have iron too, but not as much as the meat-based products listed above. Now, another big cause is gastric bypass surgery, as iron is not adequately absorbed in the new, smaller stomach. Another known cause is during pregnancy. The fetus stores iron and it depletes the mother's iron storages, typically during the first trimester, or during the second half of pregnancy. Now, pica is a very interesting cause. You mean Pikachu? No, not him. Pica is a very serious compulsive disorder where clients consume non-nutritional items like cornstarch, chalk, dirt, paper, and other items, typically occurring in pregnant women. So obviously this will lead to nutritional deficiencies, mainly iron deficiency, leading to anemia. So these clients will usually present with low hematocrit and low hemoglobin levels. Huge NCLEX tip. I would write that down. So low H&H with clients with pica. 70% of students get this wrong. So once again, think low H&H with pica Pikachu, or just pica. Now for infants and children, they often develop iron deficiency anemia from the following risk factors. Number 1 is premature birth. Number 2 is insufficient oral intake, or delayed introduction of solid foods. Now a big one and a huge NCLEX tip is number 3, excessive intake of milk. Again, write it down. Over 24 ounces of milk per day. Now preterm infants who are exclusively bottle fed with breast milk, as it contains low iron, are typically recommended to take iron fortified formulas. Now a huge NCLEX tip here is the vegan diet. So be sure to write these key points down. Vegan diets exclude all animal products like dairy and meat. So number 1, fortified breads and cereals are recommended. And we always pair, number 2, high iron foods with high vitamin C, as it helps the iron to absorb. And number 3, calcium and vitamin D is recommended to supplement the lack of nutrition from the dairy. So write those 3 key points down for vegan diets. They love to come up on Select All That Apply questions as it applies to iron deficiency anemia. Now, in terms of diagnostics, as mentioned before, the big NCLEX tip is knowing the hemoglobin levels. So once again, normally it's above 12. Now it's bad between 8 and 9, and less than 7 sends your patient to heaven. Remember, you must know these key numbers here, so write it out and know it by heart. As stated before, clients who are pregnant are expected to have low hemoglobin, less than 11. But it's very bad if we dip below that 9. So always report to the HCP immediately. Remember, anything less than 9 is bad, but less than 7 sends your patient to heaven. Now for the signs and symptoms, just make it super simple and think about the patho here. We have low RBCs, meaning we have low hemoglobin, resulting in low oxygen signs and symptoms. So we get fatigue with dyspnea, that shortness of breath, as well as dizziness and even paled skin called pallor. But the top 3 to know is dyspnea, pallor, and tachycardia. Now Hesse mentions, when assessing the patient's integumentary system, which dermatological manifestation may indicate anemia? Pallor. Yes, that pale skin. So just watch out for that key term, pallor. Now for the top tested treatments, you must know dietary sources that are rich in iron. This includes number 1, meat, fish, and poultry. Remember, they contain the richest source of iron that is readily absorbed in the stomach. Now number 2 is spinach or green leafy, as well as whole grains. Again, fruits and veggies, beans and nuts, and whole grains do have iron, but it's not as easily absorbed as meat products. So on the NCLEX and your nursing exams, always choose meats. So Kaplan mentions, the nurse counsels a client diagnosed with iron deficiency anemia. The nurse determines teaching is effective if the client selects which menu, either flank steak with green leafy vegetables or liver and onions and spinach. And Hesse mentions, a nurse is educating a patient with iron deficiency on the foods high in iron. Which meal, if chosen by the patient, demonstrates understanding of iron-rich foods? Grilled chicken thigh, see? Always the meats, as well as sauteed spinach and whole grain breads. So always choose the meats, and you should get the entire question right. Now for infants and children, we always limit excessive milk intake, since milk is low in iron, and we always encourage oral intake of iron. Now another key point is iron and vitamin C. We always take high iron foods and high vitamin C. So foods that are rich in vitamin C is like orange juice. This can enhance the iron absorption when taken with iron-rich foods. So Hesse mentions, a patient with iron deficiency anemia is to be discharged home with iron replacement therapy. Which instruction would be most important to maximize iron absorption? A glass of orange juice. Now, as far as iron administration, let's play a segment from our pharmacology master course. First up is iron, aka ferrous sulfate when taken orally, and iron dextran when taken IV or IM. Now, it's given to treat anemia related to iron deficiency. It's basically the building blocks for RBCs, those red blood cells. So big patient education key points here. Any dark or black stools, guys, these are normal and to be expected, not a GI bleed. Probably the only case and scenario where it's to be expected. Now, it's taken on an empty stomach 1 hour before the medications. So guys, iron blocks absorption of all meds. So just think that the stomach is like a wrestling mat, and iron is like Iron Man. Basically blocks and dominates everything. But here's the trick. Vitamin C actually helps with absorption. But, guys, not taken at the same time. So, Kaplan and Hesse says which one is a medical error? Well, when calcium is given with ferrous sulfate. Guys, the key term there is with. So, blocks absorption. Now, switching gears to sickle cell anemia. This is an inherited group of disorders that causes the RBCs to have a distorted shape, going from a nice round plump shape to very skinny sucked in sickle cell shape. Normally the RBCs have a lifespan of 4 months and carry oxygen around the body for adequate perfusion. But in sickle cell anemia, the lifespan is less than 3 weeks. They can't carry adequate oxygen to perfuse the body and get clogged inside tiny blood vessels, blocking or occluding the blood supply to the extremities and vital organs, which causes ischemia, that lack of oxygen to the body tissues. And this causes extreme pain during a sickle cell crisis. Now, all of this is called a vaso-occlusive crisis. The more pain, the more occlusion of the vessels. So for signs and symptoms, during a crisis, it depends on the organ involved. If a client has one-sided arm weakness or unilateral weakness, then one should suspect a stroke, a complication of sickle cells getting stuck and blocking oxygen supply to the brain. Now, swelling of the feet and hands, known as dactylitis, is also common due to sickle cells blocking the blood supply to the extremities. This is often the first sign in infants with sickle cell disease. Now, a big NCLEX tip to write down. Any words like new or sudden typically mean a priority on the NCLEX. So, new onset of paralysis of the extremities, or even sudden inability to be aroused. This indicates a critical client. So watch out for words like new or sudden, since these typically mean a priority client and a rapid response team needs to be called, since it could indicate a vaso-occlusive crisis. Now, Kaplan mentions, a client experiencing a vaso-occlusive crisis, the nurse determines care is appropriate if which observation is made. The client receives regular neurological assessments. Yes, this is critical, since a stroke is a big risk. Now, for other complications, acute splenic sequestration crisis occurs when a high number of sickle cells get trapped in the spleen, leading to splenomegaly. Fancy words for a big megaspleen. This is a life-threatening emergency, since most patients with sickle cell anemia have small spleens due to the recurrent ischemic episodes, that low oxygen supply. It can lead to deadly low blood pressure and is associated with hypovolemic shock, that severely low blood pressure. So on physical exam, one will find a rapidly enlarged spleen. So remember, think of a big old mega spleen with splenomegaly and low blood pressure. So these two key signs you must report to the HCP immediately. Now for the treatments, hydration is critical. So IV fluids are extremely important to avoid dehydration and to help thin the blood and allow the sickle cells to move around more easily. And bed rest is used to conserve more oxygen by lowering energy expenditure. Now, pain control is a big NCLEX tip. This one is the most tested, so write this down. A PCA patient-controlled analgesic pump is used, and we call the HCP for higher doses, as it's needed due to the drug tolerance. Now, it's believed that metabolism of the drugs is also altered in these patients. So don't let the NCLEX trick you here. A big test tip: never assume drug addiction or even drug abuse for clients with sickle cell crisis. We always believe the client's self-reported level of pain, and I'm telling you, 60% of students got this wrong. So always be sure to assess pain and give higher doses of pain medication during sickle cell crisis. Now, for non-drug management to limit the use of narcotics, distraction therapies are utilized, typically with children who are of school age. So watching movies is the best distraction from pain, due to the limited amount of stimulation and energy expenditure. We do not recommend board games or even video games or painting. Just think about it here. The goal is to relax and conserve oxygen, like listening to music, reading, doing warm baths, maybe even a gentle massage, or body positioning. But really, the most tested here was watching movies. Now for pernicious anemia. This was the third most tested anemia. Clients with pernicious anemia cannot absorb B12, which is a vital building block to create RBCs. This happens because clients lack intrinsic factor in the GI tract, which helps the body to absorb and take in this B12. So Hesse mentions, which factor results from pernicious anemia? The absence of intrinsic factor secreted by the gastric mucosa. So the memory trick: just think of Gollum from Lord of the Rings, who rubs his hands together near his stomach and always says, "Precious, precious." So just rub your hands near your stomach and just say pernicious anemia or precious anemia. They kind of sound the same, and since the hands are near the stomach, it helps you remember that the stomach is not absorbing the B12. Now, the signs and symptoms include glossitis, which is a huge exam tip, so write this down. Glossitis is an inflamed, red, smooth tongue. This came up multiple times on various question banks. Now, we also see extreme weakness, as well as jaundice, that pale yellow skin. So Kaplan mentions, Clinical manifestations of pernicious anemia: glossitis, a smooth red tongue. And Hesse mentions, the nurse is caring for a patient who reports extreme weakness and glossitis. The nurse identifies pale yellow skin. Which type of anemia does the nurse anticipate in the patient? Pernicious anemia. Now, the big treatment to know is B12 injections, either IM or IV. Never orally, so not PO. A lot of students get this wrong, so don't get tricked. We only give B12 injection, IM or IV. So Hesse mentions, a nurse is caring for a patient with pernicious anemia, secondary to a total gastrectomy. The nurse would question which provider's order. B12 supplement via PO. So guys, never PO, always injection. And Kaplan mentions, a client diagnosed with pernicious anemia asks why vitamin B12 cannot be given in pill form. Which response by the nurse is best? The stomach doesn't secrete the necessary substance for B12 to be absorbed orally, so only injection. And a second question. A client asks the nurse how long injections of B12 will be needed. Which response by the nurse is best? You may need lifelong injections. Yes, this could be a lifelong drug since the body lacks that intrinsic factor to absorb that B12 adequately. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share